Breast lift cost. Women who are interested in getting a breast lift must keep in mind that there are certain factors to consider when trying to determine the overall cost. Such factors include the following: the size of the breasts, skill level and experience of the surgeon, the cost of anesthesia, the facility that will be used, geographical location. In general, the cost ranges between $1,500 and $10,000. In order to have a more accurate idea as to how much the procedure will cost, it is best that you consult a surgeon to explain your situation, have your breasts examined, and figure out what type of surgery will be best for you. After all these, the surgeon can come up with an estimate of the total cost. In most cases, breast lift surgery is not covered by insurance because of its cosmetic nature, making it an elective procedure. An exception to this rule is the reconstruction of the breasts due to trauma, medical condition, or disease. Your plastic surgeon may be able to offer financing options that will make it easier and more affordable to pay off the surgery over time, instead of opting for a lump sum payment. How to determine the approximate cost of a breast lift. The surgeon's fee represents the biggest expense when getting a breast lift. Plastic surgeons charge for their time to perform and complete the surgery. In some cases, there is even a charge for the initial consultation. Plastic surgeon fees vary greatly, but remember that choosing the cheapest is not the smartest thing to do. Going for a surgeon with more training and experience can boost the odds that your surgery will be successful, which can ultimately keep the overall cost to a minimum. Another major expense involved in the surgery is the facility where the procedure will be performed. However, this fee is generally less than the fee charged by the plastic surgeon, and typically ranges between $500 and $1,500. Anesthesia fee for the surgery and the medications required before and after the operation, in addition to the expenses for compression garments and other auxiliary items, also need to be carefully considered when calculating the overall cost of the procedure. Pain medications and antibiotics are commonly prescribed to speed up the recovery process. Other costs that need to be taken into account include travel expenses and time lost from work. Most women take a week off from work, but those who have strenuous jobs may have to wait 3 weeks to a month before returning to work. Women with small children at home may need to hire a sitter to help in the interim, particularly with lifting and doing house chores. Click Next to receive tips and guidelines for a successful recovery.